Welcome to Weekly Infusion with Dr. Drew Pinsky and Dr. Bruce Heischober. Weekly Infusion addresses medically related topics. It's in the know, entertaining, and everything you want to know about health and medicine. Now may I present to you the very wonderful Dr. Drew and Dr. Bruce.
And welcome to another Weekly Infusion. Bruce, here we are.
I can't wait. I've got lots of questions for Joel.
I am very, very excited for Joel.
Yes.
Let's welcome him right on in. Joel Salinas is an instructor of neurology at Harvard Medical School, Mass General Hospital, author of a recently released book that our producer Michelle read that she just gushing about called Mirror Touch, Notes from a Doctor Who Can Feel Your Pain. Dr. Salinas, welcome to the program.
Thank you for inviting me.
And I think I read about, did I read it? Michelle, I sent you something. Yeah, I read about you online or Time Magazine or something, and I was like, oh my God, I must speak to this guy. So tell just a little bit about your story.
Sure. So I'm a neurologist at Mass General Hospital and Harvard Medical School, and kind of what I write about in the book is my experience with synesthesia, but also a specific form of synesthesia called mirror touch synesthesia. You can simply call it mirror touch, where essentially what I see somebody else feel, I physically feel it on my body. So if you're gasping for air, I feel it. If you're having a panic attack, I feel it. And it really is just kind of a glitch in the way that my brain works.
And let's explain to people what synesthesia is. Because it's for a lay public, we've got to kind of break everything down. So go ahead, synesthesia. Go ahead.
So synesthesia, not an easy term to spell or pronounce, essentially is made up of the roots syn and aesthesia. So syn means together, while aesthesia means sensation. So it's kind of a blending of the senses is really what it boils down to, where someone with synesthesia, called a synesthete, can see colors and letters and numbers, or taste flavors and sounds, or experience shapes and colors with sound. And for example, for me, when I see the word cat, the letter C is black, the letter A is red, and the letter T is red-orange, and all together it's kind of like a cloud of black with puffs of red and red-orange. And imaging studies of people with synesthesia, looking at their brain, shows that the sense parts of their brain are seem to be more connected by wiring, and also seem to be more active together. And about 4 out of 100 people have some form of synesthesia. Many of them happen to be found in the arts or music. People like Billy Joel, Stevie Wonder, Tori Amos, Lorde, Skrillex, and even Kanye West have synesthesia. It really helps them kind of to produce art that's provocative and shows us how to think and feel in different ways.
Isn't one of the theories that it's not so much an over connectedness as much as an under pruning of these relationships? There's
2 theories around it. One is this pruning theory. So I think for one, we're all born with synesthesia. It typically goes away at around age 2, where as we age, especially around early puberty, our brain begins to trim down a lot of excess connections so information can run more efficiently. So it's kind of like getting rid of streets to make room for highways. And in people with synesthesia, one of the thoughts is that they have defective pruning. So they have a lot of these leftover connections. Another theory is kind of this kind of crosstalk theory, essentially that the brain cells in people with synesthesia are just much more active, and kind of in that chatter with other cells around there, they're making new connections. So what you end up having is someone who experiences color with sound, for example. Sound enters their ear. The hearing part of their brain is active, but then so is the vision part of their brain, which creates this kind of experience of a color or an image with sound.
It's so fascinating.
But not to confuse it with a lot of people, I think, and maybe I'm a little older from the Woodstock generation, they've heard synesthesia, LSD, and that's really not true synesthesia, right? That's correct.
It's drug-induced synesthesia is what it is.
Right.
And it's interesting. So like LSD affects specific receptors in the brain, which have been proposed to be involved in kind of synesthesia as a neurologic kind of phenomena as well. Mm-hmm. And as people describe their experiences on LSD, especially kind of like lower doses of LSD, it kind of overlaps a lot with some of the experiences in people with synesthesia. Though with people with synesthesia, those associations are pretty persistent over time, and it's kind of pretty much involuntary.
Right. You're not in high doses of LSD. You're psychotic, basically.
Right.
Exactly.
and what are the receptors you're talking about for LSD?
Is serotonin 2A.
Just serotonin 2A. Yeah. I was wondering if there's something else I hadn't heard about yet. No. And when did you first realize you had something different?
Well, I always had a sense there was something different or odd about me growing up, but I always just kind of chalked it up to being a really weird kid. And, like I was very particular about the colors of my letter A, or my letter B had to be like a light orange. My number 1 had to be a bright yellow. But then also with this mirror touch experience, I watched a ton of television. And as I was watching television, I was deeply immersed in the sensory world. So like if I were watching a cartoon like Roadrunner, if Roadrunner sticks his tongue out, I feel like my tongue is sticking out. If Wile E. Coyote gets hit by a truck, I feel like I'm hit by a truck. I even had a chance to feel what it was like to be like Blanche from the Golden Girls, kind of throwing shade at.
Now, but when you say you feel like you got hit by a truck, is it feel the sort of the sensibility of being hit by a truck? I mean, what do you experience exactly?
Yeah, so I describe it as being similar, yet distant to what you would. And most of us would report feeling when you like stub a toe or kind of get a paper cut. Essentially, what the brain is doing is, in people with mirror touch, it's using this mirroring system that we all have, and is trying to recreate kind of a really vivid representation of what I see. So it's not exactly one-to-one. But it's essentially an extrapolation of what my brain is capable of. So as an example, for me with the mirror touch, it's much more vivid when I'm seeing something that's rare or unexpected. So as I was in my neurology training and began to see people who have tic and Tourette syndrome, one of my patients, he developed self-mutilating tics in the setting of a lot of stress. And as what he does, he chews on the sides of his mouth, he grinds his teeth, and he uses his knuckle to push against the corner of his mouth to the point where his lips kind of split like shredded beef. And as I'm watching him do this with each of his tics, I feel like there's like a painful buzzing shooting through my cheek and into my teeth. It's like there's a stun gun being pushed up against my face and being triggered each time he has one of these.
So when you anticipate him coming in as a patient, is there anxiety related to that, or because you're going to experience some of the mirroring?
Because in my training, the first time I experienced anything new, there was some degree of emotional distress with how vivid the experience was. But my general kind of take on it was to expose myself to as much as I could, because the more I expose myself, the less vivid these experiences would be. Basically, the less salience my brain would attribute to it, and the less kind of literal the feeling would be, to the point that it would overwhelm my attention, essentially.
But would it so I do emergency medicine, and what comes through that door, it can be crazy. Would it be preclude you from, or would you stay away from a practice like that because of the unexpected mirroring that might occur with?
For me, like I enjoy the experience of discomfort and fear. It's kind of like how I was raised, that like the area outside of your comfort zone is where you're going to learn. So like even though as a medical student, while a lot of these experiences were really intense, I was also drawn to them. So in the trauma bay, for example, a man came in with an amputated arm, and I had kind of this mirrored sensation of having kind of like the muscle sinews of my arm kind of exposed as well, and the sensation of missing an arm. And I have developed my own ways of kind of managing the acute emotional distress of it, kind of the shock of it. And it really kind of boils down to shifting my attention, my awareness of my own physical body, essentially. So focusing my attention on the sensation of my tongue in my mouth, or my toes in my shoes, or even drawing my attention away from what looks like a person or an emotion, like looking at like the omnicell, like the floor or something like that. And then over time, I've become much more adept at what's essentially boiled down to kind of like a compulsory mindfulness, which is being able to regulate my emotional response to kind of this very heightened sensory world.
I mean, to a lesser extent, we all do that in these situations that you're describing, right?
Exactly.
Yeah, it's just a very specific, illiterate version of that, or literal version. But does this make you more empathic, do you think?
Yeah, I think it does. There's actually been research looking at mirror touch synesthetes and empathy. And, there's multiple types of empathy, and one of which is cognitive rethinking empathy, which is kind of perspective taking and reasoning into the mental state of another person. And then there's affective or emotional empathy, which is almost kind of like resonating in the physical, emotional state of whoever you're looking at. And mirror touch synesthetes definitely have heightened affective empathy. And to me, that kind of makes a lot of intuitive sense, because the experience is very, very much embodied. And for me, kind of in seeing patients, it's helped me a lot in both picking up very subtle clinical cues, but also emotional cues. So as an example, I had this one patient who had developed double vision, and he came into the emergency room, and it turned out that he was basically at the cusp of having what's called the top of the basilar syndrome, a clot.
Tip of the basilar artery, TIA. We used to call it that.
So we gave him medication and were able to prevent him from having this really devastating stroke, and he walked out of the hospital. And when I saw him and followed him,
you get almost a locked-in syndrome from that.
Exactly, where you're only able to move your eyes up and down, essentially. Ugh. So as I was seeing him in clinic, he was dieting every day. He was exercising every day. All of his labs looked perfect. But as I'm congratulating him, and he's kind of giving me this sense of joy, the joy that I'm feeling mirrored in my own body feels almost forced. It doesn't feel like the same kind of mirrored joy that I feel in other people. And so I kind of decide to reason through that experience, and I kind of take a chance and press him on it. And he just broke down crying. It turned out that he'd been depressed and anxious, kind of tortured by the fear that he was going to have another stroke. Yes. And as a result, we were able to have a more earnest conversation, and we put together a plan. And eventually his quality of life improved, but I feel like that sort of thing, an MRI can't tell you, a standard physical exam can't tell you, and neither can lab tests. Well, I think the mirror touch was helpful in that.
Real good psychologists, psychotherapists, or psychiatrists, when they're deeply attuned to other patients, will be able to have a shared experience of some type that they can then bring into the room and say, I'm having this experience. I don't know if this is meaningful to you. And usually that sort of feeling felt is what it's called, is deeply meaningful for people. But it may bring out something or allow them to feel something.
Which is more intense and stressful, and that's why therapists are in therapy, right?
well, not only that, it helps you process all that, but also it keeps you more deeply connected to that process of being open to feeling the feltness of other people.
So, Dr. Salinas, what if it's a loved one that you're mirroring or that you're having synesthetic? Is it different?
Well, it can be more intense. So the longer I spend with somebody, and kind of the more willing I am to kind of embrace that mirrored experience, it's almost like my kind of mental body map extends to include them as well over time, to the point where I can suffer some of their emotions as if they were my own, and kind of doing things to disappoint them can be really almost physically painful. And there are some features that overlap with things like codependency and over-identification and enmeshment with that. Yeah. Except I think in my case, there's this kind of neural basis that's involved, and there is some overlap in some of these other kind of clinical situations like codependency. But it's something that I have to be, and I've had to learn kind of like the hard way to be more mindful of it. It really is kind of this process of being mindful of understanding, how to set my own boundaries kind of as thoughtfully as possible.
How do you do it in your head, or do you do it in some technique, much like you're looking somewhere different to deal with the overwhelming feelings associated with seeing something novel?
Sometimes it's a technique. Yeah. It kind of like looking away, or kind of drawing kind of my sense of attention to introspection, like my own physical sensations. I think a good part of it is also just kind of day-to-day self-care, just building up resilience, so that way I don't experience kind of emotional or empathic burnout as I'm seeing people.
I have some of this stuff, Bruce, and I'm going to walk down a silly path maybe with it, but let me just share. The one thing I've found to be useful is to reflect on your face an exaggerated version of what you're feeling. And that automatically sets a boundary, and it also signals the patient an appreciation of their affective states. Do you get it?
Yeah.
Wow.
Yeah, there's some really amazing research around body perception and mirroring.
Well, hold on. I'm going to get you that in a second, but I'm offering that. Peter Fonagy did a ton of research on this, and he shows there are developmental stages early in life before language where that's the primary.
Okay, so repeat.
You like, if you see somebody sad, you go because children learn to connect their primary emotional states by seeing some sort of reflection on mom. And that is, children don't understand language yet, so they see the reflected responses in mom's face. They're often quite subtle, but that gives the child.
But you do this synesthetically.
No. I have all kinds of weird physical experiences in deep relating to people, and I will say, I know, and I can always tell when I'm feeling something that's not mine. It's just new, and it's just like, well, that's not something I normally feel. Or I'll hear music, or I'll feel, something will just come to consciousness. I'll go, well, that's not normal. Like I'll feel pain here. I go, well, I'm feeling something. I get pain. Oh, well, that's what Dad used to kick me when I was 3. And oftentimes the patients will say it matter-of-factly, like, well, of course, yeah, anyway, and they'll just keep going as though, right? Do you ever experience that where it's like they're sort of, yeah, well, of course that's what I'm feeling because that's what I'm feeling.
Wow.
Yeah, there's a lot of associations that we have with the people that we interact with and kind of memories that we draw into to kind of be in kind of that resonant state with the other person. And it really comes down to kind of the fundamental kind of human aspect of empathy and kind of theory of mind, kind of understanding the emotions of actions of other people. That kind of ties into this mirroring system in the brain.
Yeah. However, you have multiple times you said bodily based, embodied, you've used your words like that. Do you think that somehow the autonomic nervous system or the body is part of the antenna for this experience that then is processed in the brain?
Yeah. I think it is definitely a part of it. I mean, it's a part of emotional processing in general.
Right.
Your
vagal
work by Lisa Feldman-Barrett is essentially she says that there isn't like a fear area or an anger area or a disgust area in the brain. That all these different brain areas are really there to detect novelty and simulate experiences, but at the core, what we call emotions are kind of the external representation of kind of what we're experiencing internally or kind of perceiving internal sensations. So like your stomach kind of turning, for example, your blood pressure rising, your heart beating faster.
So is it true that a high percentage of the vagal nerve are afferent?
Yes, 80% is afferent. But Lisa Barrett's going to be on this program in a couple weeks, so we're going to talk
exciting.
to her. Yeah. These are people people I seek out through Michelle. And Ramachandra will be on here too. That's right.
So, Dr. Salinas, can you talk about when you had the brain tumor removed and how that?
Oh yes. So I found out that I was doing a medical trip in Haiti when I developed a sudden headache on the right side of my head. And I remember, as a medical student, you're prone to thinking that you have everything, every condition. Yeah. And I was in the middle of Haiti, and there happened to be a neurosurgeon on the trip, and I just kind of casually asked him, I was like, "Hey, so what does it mean when you develop a sudden headache out of nowhere?" And he kind of looked down his glasses and said, "Oh, it usually means you're going to die."
Oh, he did?
Well, if you said a lightning bolt or a thunderclap headache, maybe
that's classic neurosurgeon bedside manner.
The opposite of what Dr. Salinas has.
Yeah, but he was really generous, and he actually had his assistants kind of walk me through the hospital back in Miami and did a lot of testing, and it turned out there was this lesion that was unclear whether it was in the parietal bone of my skull or just overlying the brain, and they couldn't really tell whether it was malignant or benign or not, or whether it was vascular or not. All I knew is it was painful, and it happened to be over my right parietal junction, which I think is interesting because this right parietal junction in people with synesthesia, the cortex in that area seems to be smaller and less active. So part of me wonders whether this might have played a role in my synesthesia in general. But either way, I ended up getting a repeat scan to kind of do watchful waiting to see what would happen, and it looked like it was growing and it was really eating away at the bone around it. So we ended up deciding to operate on it, and after I woke up from the surgery, I distinctly remember looking for any kind of writing or letters because I wanted to know whether or not my synesthesia had changed or if I had lost it, because it was such an intrinsic part of what it meant to be me that to lose it would have been pretty devastating. It'd been like losing sight of color, and I retained it, which is great. And it turned out that it was a benign angiofibroma in the end. And it was only until later, one of the boons of being a medical student in the hospital where you're being seen is that your co-medical students are kind of like informants because they happen to be rotating around all the different services that are taking care of you. And one of them happened to be scrubbed into the surgery that I was in and told me a little bit about what happened when I was there. And then another one was telling me what the conversations were like between the neuroradiologists and how really concerned they were that it was malignant. Oof. But that sort of thing was not information that was communicated to me as the patient. And I took that experience to heart. When I work with patients, I try to be as open as I can with them, so they know exactly what I'm thinking and kind of where my logic is coming from.
So I'm going to keep walking you down a sillier path. Do you ever feel like you can sort of read minds?
Interesting. So it's I feel like it would have to be proven in an experimental setting for me to be able to say that I could predict someone's kind of underlying thoughts or feelings or what they're going to act on. I do think that there's anecdotally a much higher likelihood compared to other people where I can we call it like reading people.
Yeah.
I just happen to be more attuned to it. Lisa Feldman Barrett would argue that that's that these kind of perceptions of facial expressions and posture don't necessarily tie to kind of the concept of an emotion. All it is kind of experience. But for me, with this kind of really vivid physical mirror touch experience, it's kind of like an extension of my senses, essentially, where I kind of take on this extra layer of interoception and then have to reason through it, and then in that deductive process, maybe I kind of decrease the margin of uncertainty where I might be able to make a better guess.
What does she do with the likes of you? What does that do to her theory? I guess you're not really reading faces, though, are you? Necessarily.
Yeah, it's like feeling faces.
Yeah.
I don't think it actually goes against her theory at all.
Okay.
I think her theory is pretty intuitive to me.
Yeah.
Because a lot of the things that we call emotions are these concepts are just learned and programmed, kind of like you were describing, kind of the facial expressions. If you think about kind of the two-dimensional model of emotional states, I mean, there's only two really primal kind of experiences that fit on the axis of kind of being calm and aroused, not sexually aroused, like kind of cognitively aroused, and then the other dimension being like pleasure and pain. And kind of these other emotions are essentially kind of combinations of those extremes.
I guess that's true. Do you ever pick up positive things from people? We talked all about pains and other sensory experience. Any positive things you experience?
Oh, yeah, definitely. I mean, when I think about kind of my experience with mirror touch synesthesia, I think of it like a harsh but just teacher, because there are it's whatever sensations I'm
forgive me, a harsh but just teacher sounds funny.
Because it can be painful and uncomfortable, but at the same time there's a lot of really beautiful experiences. I love seeing people hold hands and hug. It's like seeing a baby kind of giggle. Those experiences I feel them mirrored in my own body, so it's almost like I'm looking at a mirror and I am that person, or I am that experience.
And I'm going to keep walking down this sillier path. What about people that claim these sort of psychic experiences? Do you think there's any sort of weird neurological thing that they're picking up on from other people, perhaps?
Yeah, that's interesting. So, for me at least, I can definitely say that this is not psychic. This is not telepathy. This is totally neurologically based. The information has to cross through my senses and not through kind of like psychic waves in the air. But when people report psychic experiences or kind of some of these paranormal experiences, there may be something neural behind what their experience is that is being explained through kind of the lens of kind of the paranormal. So as an example, people who experience auras, there was this one study out in Spain that they kind of recruited a good number of people who endorsed experiencing auras when they saw people, and they discovered that a lot of them actually had synesthesia.
Right.
And it may just be these kind of sensory associations that people have that leads to the experience of what would be called an aura, but the aura is not necessarily some kind of magic or psychic ability so much it is a neural capacity or just a trait, just like any other trait.
But it may reflect something. They may be picking up something that's converted into a color. You know what I'm saying? That's not consciously registered, but who knows
why.
Yeah,
exactly. Yeah, it's a process that's always going on. It may not be kind of if you think about it kind of like the computer desktop of the mind, the window may not be maximized, but the process is still affecting everything else. And if there's something that catches your attention, like an element of surprise, and this is where there's a whole theory of predictive coding and cognitive neuroscience comes in. But essentially, if there's this element of unusual, kind of like anomaly detection, it'll jump into attention. But it just kind of gives you an additional an additional radar screen, essentially, to pick up on those subtle cues.
Yeah. And isn't it somewhat what Lisa Barrett's talking about too, a sort of projecting anticipated phenomena, right? Isn't that sort of how she puts it together?
Yeah, exactly. Yeah, and like a lot of work done on body perception is kind of beginning to look at predictive coding and kind of how we perceive our own bodily state in relation to the bodily state of other people, and a lot of that is kind of tied into context and memory and experience and what we've been taught.
But again, that's that antenna quality that I think there's something there that we attune to each other's bodies, much the way women have menstrual periods that go together or something. There's things that are going on that are just not in consciousness explicitly.
Yeah, I think a lot of this is going on below the layer of attention. So it's unconscious kind of processing across neural circuits that just happen to associate these experiences. Our tongue is in our mouths, but we don't feel it until we draw attention to it. And I think one of the things that you see in mirror touch synesthetes, or at least kind of this experience of mirror touch synesthesia, is on the one end, there's kind of the hardware, right? There's you have a brain that is more likely to experience that, and you find that these mirroring system parts of the brain are larger and more active, and other perception parts of the brain, the kind of parts of the brain that help us to tell the difference between our physical body and the physical body of other people, those areas are smaller and less active.
So this is something you see as beneficial, right, for you?
Yeah, I think it's beneficial. I mean, it's helped me clinically, and personally, it gives me access to be a little closer to people. It's kind of like a reflex toward compassion and empathy, and I feel like it's helped me to be a more attuned person to those around me, to be a little bit more conscientious. But there's always that risk of being overwhelmed by these experiences to the point where it becomes a big hindrance. I mean, there's just one woman with mirror touch synesthesia who has essentially become a shut-in.
I heard her interviewed on NPR.
Oh, really?
Yeah, exactly. Yeah, exactly.
Yeah.
She doesn't even have a dining room table because she can't stand the sight of seeing other people eat.
So what I was wondering... Oh, go ahead.
That was something that I've seen across many people with mirror touch synesthesia. They may not be housebound, but they require long periods of isolation to kind of offset these often kind of overwhelming sensory experiences.
So what I was wondering, from an evolutionary standpoint, is the human race progresses, is it something that'll be selected out that will be beneficial? That we
hold your thought,
okay.
Dr. Salinas. We're going to take a quick break. Be right back. Hydrolite, of course, you've heard me rave about these guys. It's a product that I actually wanted to develop myself. I conceived of this. I knew it was needed. It was already in Australia, and now it is here. It works. The feedback is unanimous. Even though it's great to use, though, when you're sick or dehydrated, you can use it every day, especially now that the weather is changing. It's hot. So whether you're exercising or maybe you got seasonal allergies or you drank too much or you got vomiting or diarrhea, whatever it might be, you can reduce fatigue and keep feeling healthy as well. Once you've started feeling dehydrated, sometimes a little too late. So you want to stay hydrated. And rapid rehydration, if you do get dehydrated, requires a proper balance of sodium, glucose, and water, and nothing provides it like Hydrolite. I'm telling you, it's the same as an IV fluid via your mouth, via your enteral system. It's based on established, proven science, quite simply the best rehydration product out there. It comes in great flavors. They have those fizzy tablets. Also, they have a powder and a premixed drink. Compared to other sports drinks, Hydrolite delivers up to 4 times the electrolytes with 75% less sugar. Hydrolite solutions are appropriate for all ages, and each bottle or package includes easy-to-follow directions. All right, you can find Hydrolite at Rite Aid or online at Amazon or click through at drdrew.com. And for more information, visit Hydrolite.com. That is Hydrolite, Hydralyte, Hydrolite.com. We are back. It's this weekly infusion. We're talking to Joel Salinas, instructor at Neurology at Harvard Medical School at Mass General Hospital. He has the mirror touch syndrome. And Bruce was asking an evolutionary biology question.
Yeah. So is this something that would be selected out?
Or maybe selected for?
Selected for, right.
Yeah. I think it's possible. I wouldn't say that necessarily not. I mean, synesthesia in general could be a spandrel, or what's called a spandrel. Essentially, it's just like a quirk, and it kind of it happens to exist. It could also be kind of ancillary. It can be like an offshoot of another trait that we have, like maybe theory of mind, and you just happen to be on an extreme end of it. It'll be hard to know whether it has an evolutionary advantage until we look in retrospect to see whether or not it proved to be something useful.
So revisit this podcast in 23 million years, and you have that answer.
So I mean, I think for at least on the spectrum of the importance of being compassionate to other people and being kind to other people in our species so we survive. I mean, I think if kind of mirror touch synesthesia, or at least kind of this capacity to be able to empathize with other people and kind of regulate our own behaviors, if that has any benefit towards helping us take care of each other so we survive longer, then I would say then it would end up having an evolutionary advantage.
It's also communication at a distance, you know what I mean? It's and I think that's where some of this came from. We to hunt together, and we'd have to work as a unit in certain.
You're really tuned into this because you have some aspects of this, and you find it's beneficial and
strictly
empathy and
it's certainly it's used to. I have found it particularly useful in getting people to re-enter the frame of intersubjectivity, is the way I think of it, being able to be close to other humans, which is a necessary feature of emotional regulation and happiness. And addicts are all disconnected, so I got very good at getting them reconnected.
Wow!
And then showing them that if they could do this with me, they could do it with a sponsor and other peers and blah blah blah. So I became the model for them then taking that out. It's possible to trust. It's possible to be felt. And guess what? It helps you when that happens.
I see it as kind of almost kind of recapturing or kind of reappropriating this sense of tribalism that comes kind of prepackaged in our brain. It's a bias towards what we find self-related. Kind of whoever looks physically like us, we're more likely to relate with them. And being kind of aware of it, engaging in the process and extending kind of that lens is really helpful. I mean, there's been a lot of studies looking at kind of this mirroring system and perception of pain and touch in other people. And what's been seen is that if you were to see a video of yourself, for example, being touched or in pain, that mirroring system would be much more active than if you were seeing a friend or a family member, and much, much less active if you were seeing a stranger or someone that didn't look like you. But what's even more fascinating is that activity can actually kind of increase to kind of a level that's closer to yourself the more you engage in the process of seeing them as related. So this one group out at the Max Planck Institute uses a virtual reality intervention, where essentially they take you into this virtual reality world, and your avatar that you're in, all it does is walk in front of a mirror, and the skin of that avatar can look just like you, or it can look like a member of your outgroup, someone that doesn't look like you. So you could be a young white woman in the avatar of an older black man. And what they find is that compared to before having been in that virtual world, you are more likely to have positive thoughts and feelings to members of the outgroup. So it's kind of like extending that sense of relatedness with other people.
I heard that literature in a iTunes U lecture somewhere. I was watching I think it was a Carta lecture, anthropogeny lectures of some kind. But that's all fascinating material. I just love this stuff. I can't get enough of it. I'm sort of awash with thoughts and ideas and different sort of notions about this whole phenomenon. One of the things that again, I'm just sort of fishing because this is such a largely unexplored area to some extent. When I've had people come up to me and say they see auras, first thing I ask them is what's their blood type. And I've seen a majority of them are AB, and I don't know what the hell that means. Anything out there like that?
I think it'd be interesting. So what's funny is that blood types is something that's used culturally in Japan as almost like a zodiac sign. Whether or not certain personality traits cluster around specific blood types, I think is hard to say. But I wonder whether there's something kind of immunologic or something developmental that could be different in people who have AB blood type, so they may be at least more willing to have some of those experiences.
Well, certainly they're rare, and so it's for whatever our genetic lineage region that's happened, right? It's a rarer combination, and who knows what genes are coming together in that rare setting to try to cluster personality traits around O positive, forget it, right?
Yeah.
But an AB or an A or something, maybe there can be little something.
Well, Dr. Salinas, you've been studied, and is there any and whether it's blood type or genetics or brain structure or function, is there something that's been correlated with
what you got?
With what you have?
Yeah, there's some thoughts around it. So one is that you tend to find synesthesia much more so in people who have autism. And even these mirror touch experiences tend to be more common in people who have are on the autistic spectrum disorder. So it's possible that there may be some overlap in the mechanisms of autism and the autistic spectrum disorders with some of these aspects of synesthesia. And there's been some genetic linkage studies that actually find that there is some commonality there. But there being kind of key differences in relation to language and social cognition between the two. But I think there may be something that we have yet to really understand that relates to maybe the pruning process in the brain or the excitability of these neurons or how these kind of circuits form that can predispose you to a synesthetic experience just as it can predispose you to having an autistic spectrum disorder.
Did you ever think you had an Asperger type spectrum or anything of that sort yourself?
Oh, for sure.
Yeah.
I thought. I mean, but I'm also a neurologist.
Yeah.
We tend to cluster.
Yeah.
Into that camp. Kind of love of like science, technology, engineering, and very, very specific niche things. I don't meet criteria for it certainly, but I like even looking back at my childhood, I had behaviors that appeared self-stimulatory or were self-stimulatory, kind of like hand flapping and that sort of thing, and having a harder time with kind of recognizing emotions or social cues like everybody else.
And then feeling extreme discomfort with a collar on your neck or...
Yeah, exactly. And there's a lot of overlap there for sure between these sensory experiences.
Hey, I've never had anybody, I know you're so thoughtful about all this stuff, really describe the subjectivity of having difficulty reading social cues. Did you have any way of describing that? I remember I've only seen one good description of it because it helps empathize with these people. You really understand what their subjective experience is. And one actual autistic kid, I remember saying that his greatest mystery was when he was riding the school bus and kids would suddenly spontaneously break into laughter. He couldn't figure out why that was happening. It's vivid, right? It's very interesting. Anything like that, Joel?
Yeah, it's certainly, it's like you're speaking a different language without words. What's interesting there is that the ability to try and kind of process like the significance of body language and facial expressions develops around the same time that language develops. So there's a translating that happens there, and it's like a dyslexia essentially, or almost like a illiteracy. For understanding kind of what these facial expressions and postures may mean. Certainly, and again, kind of going back to Lisa Feldman Barrett, it's not a one-to-one that you know exactly what the emotion is, but so much as it is trying to predict or kind of recognize what it is that you're seeing in somebody else.
But the subjective experience, was there any way you can describe that? Other than being sort of not under, like you're hearing somebody speak and you can't understand. I'm just wondering if it caused you distress or confusion or how you tried to come to terms with it. Those sorts of experiences, I think, help people understand what this is.
Yeah, well, for me, as a kid, I can distinctly recall like spending a lot of time trying to learn kind of what different physical cues meant. Like, if someone makes a joke and everybody finds it funny, I try to figure out like why was it funny, like why is everybody laughing, and trying to kind of reverse engineer it. And even to this day, like I still rely a lot more on the cues that are more readily available to me. So for example, mouth kind of positioning makes a lot more sense to me than kind of facial expressions in the eyes. Uh-huh. To a degree, it's kind of the facial expression in the eyes is kind of an intense experience, but I just have it. It kind of helps me to kind of get at the core of what I think somebody else is feeling or thinking when I pay attention to the mouth.
And is it the humor you don't make sense of, or is it the laughter, or is there is it both?
It's both. It's both. It's trying to figure out the laughter would have come out of nowhere. I mean, yeah, it really is like you missed the joke and you missed the punchline totally. So I definitely have to ask people like, what was so funny about that?
So very subtle things, or
all humor.
More subtle things.
Yeah.
More subtle things. Yeah, for me at least, is more subtle things. I think people who have kind of more kind of impairment of kind of social processing.
So is that what they say with Asperger's? You have lack of sense of humor.
Not necessarily. Not
I've read
necessarily.
that,
I think humor is a very complex kind of concept, essentially, because it involves kind of executive functioning and kind of theory of mind, and then it also ties to things like emotional salience. So it's complex, but I think being able to notice and then recognize kind of the context kind of factors into it a lot. So if the context for you is very different compared to the context of somebody else, so for example, like someone making fun of standing in line at the DMV, but you see yourself as kind of like you are you're in a thrilling space, it might not make sense for you.
So the constitutional state you find yourself distracts you from the ability to process the outside input.
Yeah, and it really context really makes a big difference. And so if you are perceiving a very different context than somebody else, then you're more likely to make errors that the group doesn't see. So, like for example, like someone who's colorblind, for them, not being able to see red or green can lead to a very different experience. Like I give the example in the book of my brother who was on an art tour. He's colorblind, and the group kind of stopped at this portrait, and we're talking about all the different experiences and the colors with it and how beautiful it was. But he couldn't see it. Like the art just didn't exist there. It was all just gray because it was the colors that he had a hard time differentiating between.
Isn't it weird that you'd be a synesthete and he'd be colorblind? It's so interesting.
Yeah, it's kind of a weird poetic irony.
Now, what about? I had two questions: historical context for this, and cultural. Are there things historically you read about or that would correlate with synesthetes in the past, and then are there cultures where it's less common, more common, or handled differently?
That's something that Ramachandran can definitely talk to as well. But one of the thoughts is that maybe synesthesia helps with language processing, but also with things like metaphor and association. So culturally, why do we describe a tie as loud or cheddar as sharp? Mm-hmm. They're very, very different senses. Mm-hmm. But somehow we have kind of made a link in our brains with those things, whether it was taught or whether there's something kind of below the surface that's kind of just how we developed in the womb. It's hard to say. And then in terms of whether synesthesia is different based on culture, I would imagine that there's some cultural context that makes a difference. So as an example, some of the work by David Eagleman, who has studied synesthesia, he has a large database of synesthete kind of color letter associations, and he found that there was kind of like a cluster of people who had very similar colors for their letters. And when he looked at what were the factors that might have determined that, it looked like they were all around the same age. And if you go back, you find out that all these people, myself included, were about 3 or 4 years old around kind of like the mid-'80s, which is around the same time that Fisher-Price released a set of colored magnet letters. And a lot of the colors actually overlap with that. So there's a learned component to it. I would say,
did the synesthete create the letters?
I was wondering the same thing. Did they design them?
yeah, maybe it's possible. I mean, people who read and write in kind of Mandarin Chinese have synesthesia as well, but it's different than kind of what we might experience, because just the actual physical form is affecting different collections of brain cells, essentially.
Very interesting.
Yeah. Just go on and on.
Anything else you want people to know about the content of the book? Like specific topics you get into or things that they can take away for themselves?
Yeah, and my hope with the book is that readers won't just learn more about neurotouch synesthesia and synesthesia and how the brain works, but more importantly, learn more about how to develop their own heightened, more engaged sense of empathy. I mean, could you imagine how different the world would be if we didn't just think about what it's like to be in other people's shoes, but also feel what it's like to be in other people's shoes? So then reason through that experience and respond from a truer, more enduring place of compassion and kindness.
And I would argue that you can feel other people's emotions in some respect, and that feeling felt. It's not just about the sensory experience; it's the experience being that person.
So is a sociopath the opposite, or is there, you think there's some brain
but they can read
area that's
that's right.
There's fascinating work done with people categorized as sociopaths, meaning people who score low on kind of surveys of empathy, essentially, where their mirroring system, like brain activity, appears lower. But if they engage in this process of like perspective taking, kind of compassion, that activity, you wouldn't be able to tell the difference between a sociopath and a control, someone who isn't a sociopath anymore. So it's something that we can engage for sure. And there's even been work done out of University of Wisconsin looking at a compassion meditation, a simple half-hour a day for 2 weeks of kind of this idea of visualizing and putting yourself in the suffering and pain of another person and then wishing them well. Leads to in kind of enhancement in kind of this trait of altruism, so people become more altruistic, and also their brain structure changes. They get more connectivity between social perception areas and the reward and reinforcement areas of their brain. So it kind of ties not just perceiving kind of the distress in another person, but also the benefit of helping them becomes a motivator to be kind to the other person.
Because we had James Fallon on, and we were talking about brain structure, sociopathy, and then I think he was talking about he could mirror, and the difference between him and an acting out sociopath had to do with developmental features and learning to mirror certain behaviors, but he could not have real empathy. He never developed that true empathy that he felt other people had. I think that's what he said.
Yeah. He, especially for his family.
Yeah, exactly. Wow. Putting him at risk.
Yeah. And he turns out was a descendant of a long line of
Cornell and Molly Hatchet.
Lizzie Borden.
Okay, Molly Hatchet, the rock group.
And that all those groups, the whole family lineage had lots of within family murder. No outside murder.
First matricide in history recorded in the United States. Yeah.
Wow, so. Put that on a dating profile.
All right, what's coming up for you, Joel? What else should we look forward to? Is there a website people should go to? Is there more?
You can find more information about me at joelsalinesmd.com. You can also find information about the book there. And then I'm on Twitter, Facebook, Instagram, and as Joel Salinas MD as well. And I'm excited to hear what people think about the book. And I'm always open to taking questions and exploring all sorts of things. Anything that relates to the brain just gets me going.
Michelle, you had a question for him?
I do. First of all, I loved the book. I will reiterate.
She's telling everybody.
Yes. I just want to know if, while listening to Drew and Bruce, does that evoke any sensorium? Like, is Drew's voice taste like coffee? Does Bruce sound like
It's funny that
Bach?
You mentioned that. So, like, this idea of mirror touch synesthesia and the cognitive neuroscience world is blending to kind of they're trying to change it into calling it like mirror sensory synesthesia, because as taking any kind of sensory cue can lead to this bodily resonance. For me, the vision is like very, very prominent, but any other senses can lead to my brain to try to reflectively mirror that experience. And in the conversation that we had, for example, introspectively, I can relate that maybe I felt a little bit calmer and kind of interested in what was being discussed. And actually, if you'll permit me to fanboy a little bit, when I was in high school, before I even knew I wanted to go into medicine, I remember watching an episode of Loveline and thinking to myself how I wanted to one day have that kind of rapport with other people, kind of having an even-handedness and listening to what they were describing.
You're talking about Adam Carolla, right?
Thank you, Joel. I appreciate that. You got.
I have no empathy.
Anything you can do at my expense, everyone's happy with that. So, but it just occurred to me while you were talking, though, that the human brain is constructed socially, right? It's a socially constructed organ, and so this all to me makes perfect sense. We would have all kinds of variations around that theme in terms of how we perceive what other people and things are going to, because that's our social brain. We appreciate other animals and what they're experiencing too, but that really is fundamentally our social brain that's doing that.
Yeah, and that's actually that is my research, is looking at how social relationships influence our brain health, kind of risk for stroke and dementia, cognition, health behaviors, motivation, all of that.
I think I've read your. Have you published?
Yeah, published. I just recently published a paper on kind of serum brain-derived neurotrophic factor and risk for stroke and dementia and social support. But I'm in the process of putting together work looking at social networks with the Framingham Heart Study, which is one of the few kind of cohorts in the world that you can actually look at people's social ties since like 1948.
And everything up. Thriving, happiness, flourishing, everything.
Exactly.
Meaning making, persistent. All that stuff is up with social relations.
Yeah.
Well, Joel, really, I appreciate the kind comments, and we really appreciate your work, and you're sharing this with the world, and I'm sure this conversation will not stop here.
Yeah.
There'll be plenty of people.
This was a lot of fun. Thank you for inviting me.
All right, you got it. Thank you, Joel, and we will come back with a few questions. Well, one of the great parts about working in recovery is seeing former patients successfully move on. And I've had patients that have come up to me years later and shake my hand and say, sometimes people are kicked out of treatment. And many of these folks move on to become mental health professionals themselves. And, of course, the field of psychology is vast. The need for competent practitioners is huge. If you're considering this rewarding career, I urge you to consider the California School of Professional Psychology at Alliant University. Now, I've known them for a long time at Alliant University. I've spoken at their past events. It was founded in 1969. It's boasts an alumni network of nearly 50,000 people worldwide. And Alliant has fostered many of today's mental health pioneers, authors, and advocates. CSPP at Alliant University hosts both on-ground and online programs in business psychology, marriage and family therapy, clinical counseling. They also offer APA-accredited doctoral programs in clinical psychology that can allow for specialization in child psychology, clinical forensic psychology, and integrated psychology. And the faculty is crazy. It's made up of leaders and historical figures like Abraham Maslow, Carl Rogers, Viktor Frankl, some of the true fathers of modern psychology. For more information, and I worked alongside of these students as well, by the way, in the clinical setting, as well as having lectured at the institution. So for more on the California School of Professional Psychology, CSPP, at Alliant, click the Alliant banner on our website or visit Alliant, ALLIANT.edu, alliant.edu. All right, Bruce, we're going to get to a few questions here. This is Haley. This is Wild. Are you ready?
Yeah.
Infant babies found under our home. Oh, yes. Sister-in-law had 2 babies, killed them, put them under our house.
Sister-in-law?
Yep.
Time to get out.
Found the bodies April 16th of 2016. She was arrested. She's in jail. Court date is July 21st. Me and the family don't know how to talk to her. She called our house to talk to my mom. Her mother-in-law, when my mother-in-law asked her why, she talked to her mother, and this my mother-in-law, and when she asked why she placed the babies under her home, she said, "Mama, I've done so many bad things, I have blocked them out, I don't really remember why I did it." So they're asking us, is it possible to not remember a bad thing that she did? We have 2 kids to protect, should we let her near them? No. Should she show us that she's changed? Oh, boy. So she really needs, extensive psychiatric evaluation.
Well, is she in? Yeah, or is she in?
There's 2 ways that there are 3 things. 1, she's lying, which is common.
Right.
2, she was loaded, like drunk or high or whatever, doing what she was doing. But the third is that people, when they're in traumatic fugue states, can do stuff for various reasons. They can be any sort of
watching Split.
No, I'm not saying NPD dissociative identity
that could be
disorder.
another.
Though DID is another reason for it. But the point is, many people will talk about redding out, blacking out, whiting out in these extreme emotional states, and they can do violent things.
But repetitive. In this
Did
case.
it twice. Infanticide exists, and it's a horrible thing.
Yeah.
It's a horrible thing. She's going to be not coming home to be with those kids, trust me. Here's somebody who I've been struggling with not cutting myself. I'm wanting to more and more. I've been stopping. I'm almost 14 years old. Oh, my God. I think about killing myself all the time. I want to know why I feel this way all the time. Please, if you can help me. Well, the cutting is just a desperate attempt to get feelings under control, usually awful, too long, too intense feelings. And the cutters do one of 2 things. They either cut to get themselves back into the body because they feel dissociated, or they cut to numb out and disconnect from the body. I don't know which version she's in. It sort of doesn't matter. It's very often a trauma thing and obviously a mood thing. She's depressed, and suicidality is a sign of that depression.
She indicated she's having help? Or
I don't know, but please get help. Please get help. This is very, very serious stuff. These are life-threatening problems. You could hurt yourself. I'm not saying you're going to, but in a really desperate state, you could. And you need to be dealing with like any other medical emergency.
Is it more common now than it was 100 years ago?
Yeah. There's a lot of copycat. It came on in the 90s and got more popular then.
How many love line calls did you have?
Writing you about the dangers of cold turkey and benzodiazepine. There's a video of a woman having seizures on day 3 of cold turkey clonazepam. I'm 6 years off Valium. Please study... Listen, I was an expert in taking people off benzodiazepines. I sort of invented the protocol for it. I was there when Upjohn came in and said Xanax is not addictive. Well, when I was watching patients climb the walls.
I have a patient on 0.5 milligram a day can't.
I don't believe in tapering. I don't think tapering works. I think you have to switch to a cross-tolerant substance.
Right.
There's a lot of place for seizure medication like Neurontin and Depakote, valproic acid. They're very important in the treatment of benzodiazepine withdrawal, and barbiturates. I use a lot of barbiturates, high dose, and then I taper that. And people on the long-acting benzodiazepines stay not well for a year. They have post-acute withdrawal for a year.
Post-acute withdrawal, I love gabapentin long-term for those patients.
A lot of gabapentin, like big dose.
But a lot of patients, I'll have patients come in referred, they're down to 1 milligram of Xanax a day or 0.5 milligram, can't.
Yeah, sure. Common.
So even at low doses.
That's right. Same thing with Suboxone.
Right.
Same thing with methadone. I misspoke. I said something like, the high dose Neurontin. Sometimes that can require tapering too.
I always taper.
But I mean, long,
gabapentin.
like it can be a problem itself. If you're using 3,200 milligrams or 2,400 milligrams or something. So, I don't want to be cavalier about it. Is my point.
Right.
Yeah.
Right.
But it is very effective and very useful.
Right.
All right, my friend. That does it for another episode. Good job. Well done.
That was fascinating stuff.
I
think you were getting in touch with some of your.
No, just remember, it all makes holistic sense to me. It all kind of, these are all properties of the social instrument that is the central nervous system. I think there's embeddedness of it that our autonomic system, as we've talked about before with Dr. Porges, is more involved in all this than we can really get yet. And it makes sense to me that there'd be overlap, and that overlap could be changed and enhanced and different in different people in terms of the experience of sensate phenomena and experiencing the sensate experience of others. Makes sense to me. It fits. All right, well, we'll wrap it up, and we'll see you next time.
Remember, you can find all these podcasts at drdrew.com. The Dr. Drew podcast, the This Life podcast with Dr. Drew and Bob Forrest, and the Adam and Drew podcast, which is available 5 days a week. Find them all on iTunes and rate us 5 stars. Subscribe and get it first. And if you're really happy, click on the Amazon banner at drdrew.com to help support the show. We'll thank you for it. If you join the email list via drdrew.com/contact, we'll send you a weekly infusion newsletter with Dr. Drew's news. We're so grateful when you get in touch. We read all your emails and we'll bring you the subject matter you want to hear about.